Kia ora koutou. I'm Ruth Spain, and this is...
Tui Pawhanaku, I can do a...
Yeah.
Kia ora koutou katoa, ko maua o tōku maunga, ko Ngāti Awa tōku iwi, ko Patuai tōku hapu, ko Kaituna tōku awa, ko Moano toi tōku moana, tamatia ki te huatahi tōku marae, no reira no mō titi ahau, ko Patuai tōku hapu, ko Nuku, ko Ranapia oku whānau, no reira ko Tui tōku ingoa. Kia ora everybody, I'm Tui, project manager tangata whenua for the organisation.
Thank you. Thank you, Tui. Let's go. Oh, there. Right. So yes, as I said, my name's Ruth Spain and I work for the Occupational Therapy Association of New Zealand, Whakaora Ngangahau Aotearoa. Welcome to our presentation about the top 10 benefits to members, to being members. Yeah.
But before we get into it, we need to let you know that the through the DHB and your employment agreement contracts with the DHB and the MECA, they can have the cost of the OTNZ-WNA membership reimbursed by your DHB by at least $414 for full-timers and pro rata for part-timers. So if you, and some DHBs will pay the full 100%. So if you didn't know this, please spread the word amongst your colleagues because surprisingly, many don't know. Oh, sorry, our membership year starts on August 2020. Our early bird prices started in May, but have now closed.
All right, so we've selected 10 of the top membership benefits and how they benefit you. The other thing we want to highlight before we start the top membership benefits is the dependence the association currently has on member subscriptions. So, whoops. Tui's already talked about that. All right, so you'll see from these two charts, the right-hand one shows the current dependence on subscriptions. All right, so that's the blue bit, very dependent. We are hoping to move to the other pie chart, which shows a lot less dependence on subscriptions. And for that reason, Tui and I were employed as project managers. All right, so resources, including local connection through access to OT Insight and to the New Zealand Journal of Occupational Therapy, and also access to bicultural occupational therapy practice journal articles.
We also offer global connection through access to journals from all around the world. We have the Journal of Evidence-Based Coaching and Mentoring, the Internet Journal of Allied Health Sciences and Practice, and the Open Journal of Therapy.
Can I ask that the participants please mute themselves so that their noise doesn't distract anyone? Thank you. Okay, there's also a wealth of guides and toolkits on the website, like Linda Wilson's Private Practitioners Toolkit, the COVID-19 toolkit that we worked on last year. There's what used to be called the Strategic Scanning Template is now called the Advocacy Template, and that is what you use as the form to communicate with the association your concerns that you want them to pick up and run with, particularly to advocate with government agencies. There's also guidance there about how to write for the magazines and the Primary Healthcare Toolkit and a self-audit tool.
Okay, so our benefit number 9 is about the association creating networking opportunities for our members. So as well as our conference, and this year our annual conference will be online again due to the COVID risk, and that's happening in November. We also have workshops and webinars, webinar presentations. So if you have a hot topic that you'd like to present, please come see us. We'd love to get you connected with the rest of the profession and our members. There's also our special interest groups online, as well as our social media presence on all the usual platforms, Facebook, Instagram, Twitter, LinkedIn, and YouTube. Just in regard to our online event, we'd love to hear from you if you have any suggestions for keynote speakers. And for that, we're prepared to go globally just to achieve a really great event. And I just want to add that box in the bottom left of the screen right now, that is what the new special interest groups platform will look like. Nice and clean, easy to access. And you will be accessing that through the website directly. All right, benefit number 8 is that membership in OTNZ-WNA also gives you automatic membership to the World Federation of Occupational Therapy. And having access to this includes benefits such as position papers about, I don't know, being a supervisor, about being a driving instructor, about any of the specialist areas of occupational therapy. Also, occupational therapy news from around the world, products and services, and opportunities to attend online global events. There are also opportunities to make submissions to global organisations like the World Health Organization. So benefit number 7 is about supervision resources, and we support our members to meet their supervision needs through a supervisor's register on our website. If you are thinking about becoming a supervisor and offering supervisor services, please don't hesitate to pop your name up there through our website. And additionally, we have supervision helpful tips, position papers, and self-audit toolkit, which we mentioned a little bit earlier.
And benefit number 6 is highlighting employment opportunities. So you'll see from here that there are some a list of vacancies. They're all closed. So don't try looking too hard and squinting. When DHBs or private employers are looking for occupational therapists, we have a list of vacancies available that you can access, but you must be a member to be able to access them. It's free for you also, and for clients who are wanting to access an occupational therapist, like they've been waiting too long on the waiting list, perhaps, don't know what Waitemata's waiting list is like. So they can click and find an OT on our OT database. The occupational therapists who advertise themselves on there. So this is another area, the Find an OT area is where private OTs have advertised themselves and their services. They list their main areas of practice and the public can find them based on that. And also the locations in which they practice. So we also do a regular scan of something called the New Zealand Government Electronic Tender Service, GETS. So this is really for OTs looking at working privately, where they look at what tenders are on offer. Things like ACC tenders are always advertised through here first. So that's how people can access that information.
Okay, benefit number 5, celebrating excellence with our awards. We love celebrating and honouring our occupational therapy achievers, of which we all are. And OTs can inspire us all. We have the Francis Rutherford Lecturer Award, which recognises outstanding role models for occupational therapists in New Zealand. And we have our Achievement Award, which recognises exemplary practice. We have our Graduate Awards, one for each school for each year, and our Hazel Skilton Founders Award that recognises therapists who demonstrate inspirational leadership. So our members can nominate OTs via our website or by contacting the office staff.
All right, so benefit number 4 is continued professional development opportunities. Now there is change happening here. We have signed a reciprocal agreement with Australia, Occupational Therapy Australia, for sharing CPD courses. Now, I don't know if any one of you have had a look on their website. They have a lot of opportunities. So soon, very soon, you're going to be able to, through the Occupational Therapy New Zealand website, you will be able to access their CPD opportunities at a discount. So you'll go through a non-members and you'll be able to get a members discount.
We've also recently gone live with sleep health. So through a partnership between the association and Annie O'Connell, who you'll see there on the screen, we bring you Sleep with Disability, Te Moe me te Hauātanga. And this is a self-paced online training webinar series. It does have a pediatric, child and young person's focus to it, but many of the strategies can be used across all the ages and stages. This self-paced online training webinar for your convenience, is a permanent and continual fixture in our training calendar. It will also be open to all health professions, the medical profession and other organisations, but of course we have discounted access to our members. So please feel free to pick up the link from our website and send it out to all your networks.
Great. And in this new normal, with e-health and telehealth being so much a part of what we're doing, we're learning, we have some great resources on the website for those too, including webinars, links, and useful information about working remotely and communicating with clients via devices. Okay, benefit number 3, expanding our practice boundaries into new territory. OTEAP services, it's an exciting new initiative to offer our members a golden opportunity to lift their professional profile. And we are in the fairly early stages. We've had our inaugural meeting with our OTEAP services task force to bring this program together. EAP in general offers independent and confidential counselling and assistance paid by the employer. It also supports in multiple ways, from consultation to individual assistance, and as a workplace program designed to assist work organisations in addressing employee productivity issues. And they support their employees and sometimes their employees' families in identifying and resolving personal issues due to poor health or marital issues, family, financial, alcohol, drug and legal and emotional issues, and so on. Any personal issue that's affecting job performance. So we're aware that your DHB offers EAP, but we're wanting to offer an alternative option for everyone. Feedback from our membership tells us that the EAP industry is quite difficult to get your foot in the door. Traditionally, the employers will advertise for other professions like our psychology or counsellors, nurses, social workers, because they're unaware of our occupational therapy skills. But we know that EAP is very well suited to occupational therapists, particularly those who are skilled in areas like mental health, talking therapies, grief counselling, addictions, relationship conflicts, family therapy, and workplace coaching. So OTEAP's main purpose is to enable occupational therapists to expand their practice into the industry. And our point of difference from other EAP services is, of course, to the importance of weaving in occupation.
Our future intention is to broaden OT-EAP services by partnering with specialists like to support our operations, for example, lawyers, doctors, HR specialists, accountants, and tikanga advisors.
Thanks for that comment, Linda. I'll share that at the end. I'll answer that in the end. So, another new area is the HIP practice. So health improvement practitioners. So this is an emerging workforce that's based at primary health, they're primary health roles based in GP clinics. We noticed that PHO employers were tending to advertise for psychologists, counsellors, nurses, and social workers to fill these roles. So we've been advocating on the behalf of occupational therapists, and we've noticed that they are now including occupational therapists in the list of professions who should apply. We also know that there is one particular area in the country where occupational therapists have 3/4 of the roles available.
Yes, that's great news.
High profile. So we've been openly advocating for occupational therapists to move into these roles because we know this suits our skill set very well.
Okay, our treaty relationship governance model, our bicultural practice resources and support. We operate under the treaty relationship governance model, or TRGM, and this was implemented in 2015. It was a journey that took 25+ years to realise, and proudly the association is the first allied health professional body to operate in this way. This model reflects a true te tiriti o Waitangi partnership between tangata whenua and tangata tiriti, where there's equal power sharing amongst the leadership and operations. Under the treaty relationship governance model, we have a council that consists of 4 Māori tangata whenua councillors and 4 tangata tiriti councillors. This includes 2 presidents, 1 from each house, and they share responsibilities and they co-chair the meetings. We have 2 councillors who hold the portfolio of World Federation of Occupational Therapy, or WOFIT, delegates, 1 from each house, so that we have equal representation on the world stage. Our council subcommittees, we always aim for an equal number of tangata tiriti and tangata whenua members. There is equity of responsibilities, spread or jointly undertaken as deemed practicable, and Ruth and I were employed in February 2020 to reflect the TRGM and the Te Tiriti o Waitangi partnership. In our roles as project managers, we work quite closely together on all our projects, and I'll cast a bicultural lens over our work before it's presented out to the various audiences. So what does this mean and how does this benefit our members? In Aotearoa, yes, we live in a multicultural context, but importantly, we do live in a bicultural context that's protected by legislation. Te Tiriti o Waitangi and our legislation such as the HPCA Act require us to practice cultural competence standards that will enable effective and respectful interaction with Māori. So for our members, they can look to their association as a role model of what it looks like to practice an equal partnership. And in the spirit of Te Tiriti o Waitangi, we demonstrate our commitment through providing members with resources to support their growth in bicultural knowledge, practice and respectful interaction with Māori. And some examples are, as mentioned before, equal partnership on decision making, intentional, and I always get put off by that slide, sorry. Ruth is supposed to take that down, replace it with something else.
Working on that.
Intentional and purposeful use of te reo Māori and Māori imagery in our communications. Use of tikanga within the team structure and in our interactions with members. Collaboration and guidance with overseas stakeholders. So for example, The sleep health program with Annie O'Connell is actually from Australia, and we worked quite hard with Annie to weave a bicultural lens into their training. We have language resources, or rauemi reo, and access to cultural advice. You can call me. And under the Lifting the Profile project, which Ruth will talk a little bit more about shortly, we have a long-term project in collecting stories from occupational therapists where OTs are making a difference through both the tangata whenua and tangata tiriti lens, and where proactive practice or innovation shines through occupational therapy. So tangata whenua OTs are few in number, therefore their stories are also few. So in the spirit of the TRGN, there's a particular focus on gathering tangata whenua stories to lift the profile of Māori occupational therapists in their mahi.
So benefit number one is lifting the profile of occupational therapy. So raising the profile benefits everyone. OTNZ-WNA does this through year-round advocacy and submissions to Ministry of Health, ACC, Members of Parliament and other associations like Hand Therapy, SANS, etc. Okay, we also raise public awareness of what occupational therapists do by telling our stories through multimedia. We're beginning discussions about what micro-credentialing might be for mini courses and credentials through the OT board to add on top of our current qualifications. Sorry. So we're also working on implementing new areas of practice, like in the health and safety and in the OT EAP and health improvement practitioners. And at the moment, we print stories in our own publications, but there are plans to target audiences outside the profession into things like government ministries, allied health associations, and the public.
So there you have it in a nutshell, everyone. That's our top 10 great reasons to join or renew your membership in 2021. So our membership renewal drive started at the beginning of May with our early bird prices, but this is now closed. If you are wanting to renew or join the membership, please see Katrina, would it be? Or Louise, Katrina or Louise. Or you can contact the office and our office staff will happily guide you through the steps of becoming a member. Are there any questions? Well, there's already been one or two come through, so we'll just skip to that chat screen now.
Right. So, Linda Mance was asking whether or not we'll be advertising the OT Australian Access when it becomes available, and absolutely we will. It will be very beneficial to practice to be able to access training, to upskill, absolutely.
We have a bit of a tentative plan at the moment to be advertising August the 6th to coincide with something that is happening with the OT Oz. So yeah, look out for that. That's just around the corner, a couple of weeks away.
Yep. Undergrad scholarships, Romilly. Thanks for that question. Don't know of any undergrad scholarships, only postgrad scholarships. You could contact the office to ask that question of the office staff. At this point, none that I know of.
Having said that, if you do know of somebody that can offer, please offer a course of sorts, please let us know.
It's more, I was asking just because I have a couple of contacts who are really interested in studying occupational therapy, and they would be absolutely amazing people to have as occupational therapists. And yeah, but of course always money is a barrier, and so if OTNZ had scholarships especially for people with lived experience of disability. I think that'd be an absolute fantastic thing that OTNZ could offer.
Romilly, could I ask you please to email me on ruth@otnz.co.nz so that we can begin that conversation?
Okay, great.
Because I do know of funding that has come up at times, not necessarily to train, but to actually be members for the initial year. Although, as a student, the cost of being a member is only $36 a year.
I was meaning more undergrad scholarships.
I realise that. I realise that. Yeah. And first grade year membership is cheaper than the $572 that it is a year now. I realise you're talking about support to train. Yeah. Okay, hang on. No more.
Any other questions?
Yes, are there any other questions?
Oh, yes, there's a live person over here asking a question.
I'm just wondering, with the employment opportunities that come up on the screen, how do they get populated? Where are they pulled from?
So the question is the employment opportunities that come up on the screen. Can you repeat it?
On the website?
On the website.
Yep. So an employer, either a DHB or a private employer, will contact us.
So you're not
And
pulling
advertise.
them from Kiwi Health or anything like that?
No, they advertise on our website as well as Kiwi Health and Seek.
Unless it's something like HIPS, when we're very active in keeping an eye on Seek which employer is advertising, and we'll give them a call and and ask, can we advertise on our social media for free, which was always very attractive offer, and is
we've just stopped that, I'm afraid. It does.
Normally
it does cost.
Yes.
Yeah.
But in the interest of expanding our practice boundaries and the benefits to our members, it seemed a really good opportunity to offer that free advertising on our platforms.
So that's one way we've helped increase the numbers of health improvement practitioners.
Is by literally
OTs.
knocking on the doors of the employers.
Yeah. That was one of my projects. All right. So did we have any other questions from the...
I had another question.
Sure.
In terms of utilising the social media networks, how can members have access to that? I'm just thinking of an example. I have celiac disease, and I made a resource and offered it to OTNZ to share on their social medias. You know, it was Celiac Awareness Week, and thought that would be really useful. But I was advised that I would have to pay advertising fees for that. So I'm just wondering, how can members sort of utilize and contribute to, you know, the social media community?
Sure.
Yeah, how can it be made more accessible?
So we have various social media platforms. So you could have you on Facebook ever joined OT for OT?
Yeah.
Okay, so you could have put it on there.
I was just thinking more as being a member of OTNZ, what opportunities are there through that network to bring awareness to different things, that because lots of different members might have different ideas, and it just, you know, kind of contributes to that sense of being part of the OTNZ network. Or being supported by the OTNZ network.
Okay, so a lot of that has been done on our special interest groups, SIGs. So that could have been put on because you weren't advertising a job or advertising a service. You were advertising
like an image that said, Celiac Awareness Week, what to look out for.
Yeah. So to me, that shouldn't have been charged. So would you please forward me the email conversation you had with our staff members so I can deal with it?
Back, but I'll
was it? Okay. So, I believe our current setup would allow you to do so without funding.
Okay, that's good. Thank you.
Yeah. Okay. Well, it is 1:35. Do we have any other questions? No? Okay. It looks like there is another chat. Let me have a quick look. No, there isn't. Okay. So thank you very much, everybody, for taking part in this. Please be in contact with Katrina or Louise regarding a membership and having the cost of your membership or a partial cost of your membership reimbursed. Please be in touch with them, and we look forward to seeing your name on the lists and to working with you.
And I'll close with the karakia, if that's okay. Kia hora te marino, kia whakapapa paunamu te moana, hei huarahi mō tātou I tēnei rā, aroha atu, aroha mai, tātou I a tātou katoa. May peace be widespread, may the sea be like pounamu, pathway for all of us this day, respecting one another and binding us together in our mahi. Have a great day. Kia ora.
Ka kite.